Okay. Hi, everyone. Thank you so much for sticking it out to the last session of the week. I am Dr. Allison Levine. I use the pronouns she, her, hers. My student Lonnie could not be here with us. She got sick at the last minute and couldn't make the trip. But hey, Lonnie, I'm sure she's watching on live stream. So our presentation today is Born This Way, but the actual title is Supporting and Protecting LGBTQ plus students in counselor education and ethical and social justice considerations for supporting our queer students. And so today we'll go through a number of things pertaining to the much needed and overlooked area of our student population, and ways that we can support them, given the things that are happening within our programs, within our institutions, and within our states. So some of the things we'll go over today will help hopefully talk through understanding the needs of LGBTQ plus students in rehabilitation counselor education programs, identifying our ethical responsibilities to LGBTQ plus students, applying a framework of humanistic student-centered pedagogy to working with LGBTQ plus students, and understanding the ways we can expand inclusivity in rehabilitation counselor education programs. And I'll also say, I firmly believe that this applies to rehabilitation counselor education. It also applies to other counselor education programs, as well as any type of developmental model embedded in a vocational rehabilitation agency as well. Because when we learn ways to be more inclusive and be more student-centered and open-minded, we are doing good in all those spaces. Please feel free, since we're in person, we're a relatively small group, so please feel free to pop up with questions as they come. Stacy is going to let me know questions as they come in on the Zoom, if any do. I'm happy to have this be a dialogue and to talk through different things. And just at the outset, I will start off with my own identity because I think it's important for us to have that representation. And so I identify as a queer woman. I am cisgendered. And as I said before, I use the pronouns she, her, hers. So it is not news, hopefully, that it's not quite safe to be yourself in many spaces, not just in red states, but also in blue states and in many different institutions. And as counselors, as educators, in vocational rehabilitation, we all occupy space in agencies, oftentimes governmental agencies or public institutions, and institutions that are beholden to state and federal laws, of course. And so a lot of what I hear from students or even my colleagues is that they don't want to listen to the news, they don't want to read it, and it's depressing and all these things, which is not inaccurate, right? But also we need to know what's happening so that we can support our students and be aware that these things are happening, and that changes how they show up in the spaces that we expect them to, have this quote professional demeanor, right? But if you just found out that somebody you love or yourself lost civil rights in your state, probably when you show up to my med aspects class that night, you're going to be pretty upset. So I just took a smattering. This took me probably less than 5 minutes to grab a smattering of headlines this is all within probably the last 3 to 5 months. So just anti-DEI legislation negatively affecting LGBTQ plus students on college campuses, tracking anti-LGBTQ bills. And so a lot of people will sort of say, oh, those bills didn't pass, right? Or they're just there for fear mongering or those kinds of things. And that works. It is scary, right? So it is one thing to say you don't want to follow it, you don't want to think about it. It's another thing to minimize the fact that your very way of being is possibly going to be deemed illegal, or that you can't just take up space loving the person that you love in the different places that you occupy. Other things, directly related to our work as counselors, counselor educators, is the relationship between this legislation and mental health and suicidality, right? So the Trevor Project has identified that there are links to higher rates of suicidal ideation in states with very hateful anti-LGBTQ legislation. And so we can also see that there's LGBTQ plus youth, their mental health is suffering in states with anti-trans laws. And I will note, that's not just trans students who are being negatively affected, right? So there's this, like, I think people are like, well, there's not that many trans students here, and so that must not be a problem where I'm at. But actually, it affects the whole LGBTQ plus community because we are a very inclusive group, and what affects one person affects all people, right? Because it's a slippery slope to go from I'm taking away civil rights from this one letter of this acronym. It's okay. What about the rest of the letters? Right? When are we next on the chopping block? So I'm starting here not to be panicking or to be horrible or to make you, feel negatively, but to really just center us on the reality of the lived experience. Because as counselors and counselor educators, right, we talk so much about empathy and helping our students learn how to see something from somebody else's perspective. And yet when it comes to what's happening for our students, I think a lot of times people take a different approach, or they think that that doesn't apply. And we need to learn how to better stimulate empathy in ourselves if you're not a member of the community, or in our peers and our colleagues who are, also having significant roles in the lives of our students, because they can do a significant amount of harm. So LGBTQIA students in higher education experience microaggressions. Obviously, there's a lot of hateful rhetoric around the LGBTQ plus community. There's also, back in the 90s when I was a kid, it was like people would say gay all the time as like an insult or something like that. I'm telling you, in 2025, I still hear it of my students. LGBTQ plus students experience increased mental health needs on college campuses and often don't get those supports. And now as we move into a space where, for example, in my state, they're taking away the cultural houses on campus, which is a place that students would often get community-based support, right? Support from within their community. And so without, the Pride House, a student may not feel safe enough to go to the University Counseling Center, right? And so then those are mental health needs that are going unaddressed, and then can certainly increase the likelihood that that person drops out, that that person engages in self-harm or other, maladaptive coping skills, and just it doesn't end up having the opportunity to fulfill their goals. And so there's increased rates of suicidal ideation as well, again, by virtue of it being an isolating experience. Oftentimes students come into higher education and find their identity or identify their identity or revise their identity, right? These are all good things typically that we associate with the experience of higher education, and we want to encourage, and has always been sort of a notion that we have about what it's like to be a college student, right? You leave the house for the first time. I'm in Iowa. I have a ton of students from rural communities coming and coming to me in their first semester during my multicultural class and talking to me about, I never had space to talk about this before. I never really thought about it before, but I kind of always felt a little bit different. And they're starting to have the opportunity to think differently about how they've internalized heteronormativity, right? And so when that experience is met with isolation, othering, invalidation, they're likely to have more negative mental health side effects, of course, and then suicidal ideation because of that sense of like a thwarted belongingness. And so then there are, of course, intersectional considerations as well. So we know that the LGBTQ plus community has higher rates of disability as compared to the general population proportionally. So we have a lot of students who are queer and disabled, right? And so what considerations are there for how they are experiencing higher education when we know institutions are already extremely ableist and oppressive spaces, that where somebody can't even physically enter the room, and then they can't maybe emotionally enter the room as well, right? Or show up in the room as their authentic self. Not to mention racial and ethnic minority groups and how they might experience intersectionality relating to a queer identity. If, you know, a home community is not supportive, if they're an international student. I recently had an international student who came out to his parent in his first semester in our program, and his dad cut him off entirely. Didn't want to see him, didn't want to talk to him, didn't want to like fund him, you know, support him anymore. And, you know, that's a really hard experience. Not only are you in a different country than your family, you've now felt, you know, like you could be authentic because you've learned this, you've been in a space that, you know, facilitated that, and then you were met with, that's not okay. It's still not okay. It doesn't matter. So we really need to be aware of the breadth of experience and emotional experience that students have relating to their queer identities in particularly a higher education space, as we are trying to create supportive environments for them to become counselors, right? Because that's part of the gig. There's invalidation and minimization, right? So I was working to plan a coming out day for our Counselors for Social Justice chapter. And I had someone say to me, do people still need to come out in 2025? And I said, well, I do, like every day. Like I walk around looking like this. I used to be married to a man. I have to come out all the time in every different way, in every different space that I take up. And that's a choice, right? So students experience that even more so. I get to throw around the word doctor, right? So I can take up space differently. Our students don't have that same ability. And so if they choose to share their identity in a class or in a micro skills role play or something like that, they may often be met with invalidation and minimization because somebody doesn't know how to handle it. And I'll talk more about that in a little bit. Queer students deserve joy and representation. And so this happened in my class a couple of years ago. I had a student, I was covering trans identities, and it was heavy and hard. You know, in the state that we're in, things are not good or safe for trans people. And I had a student who came up to me at the break and asked me, like, can we show some queer joy? And so we do sort of see a lot of times that we're sharing the hard, the negative, the uncomfortable, the exclusion, the suicide, right? But like also there's a space for us to show, you know, queer representation in happy and positive ways. And our students deserve that joy and to feel included and to have representation. Every single semester, for the last, I would say 2 years, I have had somebody write in one of my course evaluations that they appreciated having a queer professor, and that I talk about it and that I brought it into the classroom. And queer therapists and counselors are in high demand. People want more representation in our field, right? And so again, if we think about the fact that there are high proportions of disabled people who have queer identities, and we don't do a good job of flooding our student populations or supporting our queer students who are in our programs, then we are not meeting the market. We're not meeting the need. And so then what is happening? How does that possibly affect our outcomes, our return to work, right? Our quality of life, because that's a whole area of someone's identity that we're not addressing. And if we're truly being holistic and strengths-based counselors, we need to be addressing the full breadth of what somebody brings into the room with them. So of course we have an ethical responsibility. This is not as on my thing, it's much more, the contrast is better. I checked it. I checked the ratio, Christina. So CRCs recognize diversity and embrace a culturally relevant and responsive approach to support the worth, dignity, potential, and uniqueness of individuals with disabilities within their social and cultural context, and bracket their personal values and beliefs when working with clients. This is just like straight out the gate what we do and what we believe, right? And so any deviation from this, I don't care what you believe or what you think, is not ethical. Right? Like any moment that we deviate from this statement, that we say, well, but not this group, or but I'm not sure, or but I don't have experience, right? We're deviating from our ethical responsibility to care and show up for people who are needing our services and deserving of our support. And so as educators, our responsibilities are to facilitate self-growth experiences, So sometimes that's uncomfortable, right? To think about the fact that it's my responsibility to make sure that my student has not only the content knowledge that they need to, check the boxes on the CRC exam, but also that they need to learn about themselves enough to show up as their authentic self in a counseling session in a way that is true for them, in a way that is going to help them build effective relationships with their clients, and for them to be like a happy and whole person. Right. And I think that part of our educational programs often goes by the wayside. And that can, and in my experience, has included students needing to grapple with their identities because many of our students are at that age. They're in their early 20s. Things are weird. They get into serious relationships sometimes for the first time, or they're, away from home for the first time. And, they have all these new and different experiences that we should, we don't need to be like involved in their personal lives necessarily, but they may need us to show up for them in a way that we're not familiar with because they have an identity that they can't talk to anybody else about. Student disclosure of personal information. Students may come out over the course of a program, right? And so it's our ethical responsibility to protect their personal information. It's our ethical responsibility to, maintain their confidentiality, and more importantly, not more importantly, but just as importantly, their privacy. I'm going to talk more about that in a minute. And then multicultural considerations in teaching and supervision. So we have made some advances in the way that we are including marginalized groups in teaching and supervision. And at the very least, I think people know they can't really get away without having like their 1 week of diversity, even in the non-diversity related classes, which is of course not enough. If you've heard me talk, you probably know that I feel that way strongly. But where our queer communities are in these representations is very far behind where our other, understandings of like culturally relevant, pedagogy or supervision models, we're not up to speed in the same way, but it's our ethical responsibility to be at that level. And then we have educator competence. So cultural diversity in rehabilitation counselor education. This is a mostly empty room. I'm okay to say that. We don't have a robust offering of presentations about the LGBTQ plus community in our rehabilitation counselor education, or even in the broader counselor education spaces. And so how are we then saying, it's our ethical responsibility to be to have cultural diversity not among our faculty, and to have the competence to work with folks from culturally diverse groups, and we're not attending to the professional development needs for our faculty to be up to speed, right? Especially right now at this time where things are super not good, right? They're pretty bad. So that's something that is, again, it's our ethical responsibility. And sometimes people feel like they don't want to take up space, or maybe they're like me and they're pre-tenure, or, they just don't want to get involved, or they just know somebody is going to be hateful, or, they're going to get a negative response from, trying to intervene. But I think, our most recent revision to the ethical code is fairly robust and clear in this way. And I think that we need to have more people being brave to take up space as allies and as, owning their identities in our field. And so then this directly relates to ACA as well, right? ACA is almost a decade old at this point. Hopefully we'll see the revision soon. But it is relevant for us to maintain our ethical codes on both sides, right? Very few people operate in just a program that's just rehab counseling. And so we need to be able to speak to it across all the programs that we're teaching in with our doctoral students, and to be able to say, these are our ethical standards and we will not stand for anything less. So, attending to client welfare, making sure that we are capable and giving the highest quality of care, and that our students by extension are doing that, right? And that they're capable of doing that, and they're not, leaving our programs and thinking they're going to be providing conversion therapy, which is still legal in the state of Iowa, right? And many other states. These are things that it may sound controversial and crazy to bring up, but it's a fact. And if I can bring that up to my students' attention and they can feel shocked by that, that's a good disorienting moment for them, right? Again, we have multicultural issues and diversity in supervision. So looking at those dyads and what kind of queer competence there is in supervisory dyads and whether we're doing enough for queer supervisees. One thing that and this relates to the next point too about counselor educator competence. One of my first semesters at Iowa, I had a trans doc student come and talk to my rehab counseling internship section because my students who were working with transition age youth were noticing they were having a lot of students curious about trans identities and thinking that they're trans and wanting to learn more about how to essentially move more authentically through the world. And so my students had like a lot of really great questions. And so I brought this doctoral student in because they're a trans person and they do trans counseling. And so it was like a perfect mix. And the amount that I learned from that, and I consider myself to be, pretty abreast of these things, but that they would say, we normally would say, you should be out wherever you want to be out, right? And Kaylin said, if you're working in rural Iowa, you absolutely should not be. It's not safe. You could lose your job or you could be harmed physically, right? And so, or emotionally. And so my own competence needed to be updated because I was, making assumptions based on what I would consider to be, strengths-based, positive psychology, holistic type of counseling. So infusing multicultural issues and diversity. So again, like this is not an add-on, it's not a sprinkle on top. So, how you move through the world when you're queer and how you move through the world or how you get to move through the world when you're not queer are two very different experiences. And one gets to be infused throughout everything you do and nobody bats an eye. And the other takes a minute for most people, right? It's a reaction. It's not just, oh, okay, you mentioned your wife instead of, I talked about my husband and no one even blinked an eye, right? Like those experiences are and you can feel the difference when somebody responds to you, right? When somebody needs a minute to process what you've just said. And that's a scary minute. Field placements, again, coming back to thinking about ethically, we have a responsibility to our students, not only to just give them field placements, right? But to be ethical in the way that we do that and making sure that they are safe in those field placements. And so not only does that mean having transparent conversations about your identity and how you show up in that space, whether it's how you dress, how you present, what name you want to use, all of those kinds of things. It's not to say every space is going to be perfect and inclusive, but it is to say it is our responsibility to prepare our students for what is out there because we would do the same thing for a client. Right. And for some reason, again, sort of when we come back to turning the mirror on ourselves, we don't always do that. For example, we have a lot of placements in our mental health counseling program that are, a lot of private practices that oftentimes have sort of a faith-based component. And so I've started asking, do these students understand what that means? Have they been told? Do they, do we know what that supervisor is going to do or how they're going to respond to this? Again, self-growth experiences and competence in counselor education and training programs, ensuring the diversity of our student bodies, allowing them to show up as diverse individuals, to grapple with their identities, to be open with their identities in our programs, and then more diversity competence that we are ethically responsible to do, right? And so in embodying all of these things, how do we teach for safety? How do we keep our queer students safe? How do we show up and model safety? And I know a lot of people these days, hear the word safety and they like roll their eyes, right? They're, everyone thinks everyone's so soft these days. But psychological safety is so important for learning. And so how can we look to including queer pedagogies in what we do, in our literature, in, helping someone when they're learning something new, in the doc program, right? How do we infuse some of these things into what we're doing? And these are just a snippet of ideas because I'm not going to have enough time to cover every single thing, but I'm happy to chat if people want to. But number one is challenge heteronormativity, right? It shows up everywhere. Everything is made for a man and a woman to be together forever, a cis man and a cis woman, right? Everything exists in binaries until you're looking for it not to. Right. So we as professors, as educators, whether you're queer or not, Just because you're queer doesn't mean like there's magic set of glasses that you get when you get your toaster oven that you get to suddenly see things differently, right? You experience things differently for sure, but there is still that heteronormativity so deeply ingrained in our society, from the theories that when we talk about the dynamics of families up through, the bathrooms that we use in our, day to day. And so I'm going to give you some sort of reflective questions in a little bit, but really just sort of thinking about, I have a 3-year-old, right? And a number of my friends have like small kids also. And the amount of times that I hear about like when a little boy and a little girl are getting along, like, oh, they're boyfriend and girlfriend, or oh, she must love him, or it's like, she's 3. She loves Bluey, also Spider-Man. Right? Like to impose that onto her. And I can hear when she's saying different things about like what is for a girl and what is for a boy. And sure, that's about gender identity, but a lot of that comes back to heteronormativity because it all centers around this notion that a boy and a girl are supposed to be together. And that's oftentimes shows up in our classrooms in ways you probably don't even realize. And I'll talk more about that in a little bit. But including queer voices intentionally, right? So oftentimes we will throw a name up in a citation to make sure that it's appropriate with APA and, above board and everything. But how do we do representation properly? How do we actually seek out queer scholars, throw a picture up, actually have our students think about who wrote these words and what does that mean? Right? I'm happy. You can all cite me in your classes. It'd be great. You can throw me up there. I'm happy. But there are queer people in our profession, in counselor education, in psychology for decades, and that we can be intentional about how we represent them in our classes. And it might feel like having to do an extra step, but it really does matter. And it helps our queer students feel seen and have that experience of knowing that it's safe and okay to take up space in your classroom. Using inclusive language, right? So you'll notice I'm generally using the term queer, but not being afraid to use different words when appropriate, and to be just generally, thinking about, oh, am I saying something in a binary way, right? Am I addressing the whole room saying guys all the time? Am I, falling into habits where I assume maybe that someone has a husband just because they present as female? Am I assuming someone's pronouns? Am I not making space for somebody to tell me differently? Right? There are different ways that we can move with inclusivity in our classrooms, and you can pick what feels authentic to you, right? It doesn't have to be that you do everything perfectly. I deal with this a lot with the students and my colleagues, honestly, that people think that if they're not, all the way over here on like the, screaming liberal feminist spectrum that I am, that they're just going to mess up. And so it's not even worth trying. And that's a fallacy, right? In the same way we would talk about working with a person with a disability or a person from a racial or ethnic minority group, that they just want to see that you're being authentic. It's the same thing. And, we just put everybody in these boxes and think about them in that way. And it's so scary, maybe illegal. I don't really know anything about it, so I must not be able to talk about it. Or it's just uncomfortable for me, right? I don't think about my students as sexual beings, right? But they are, right? They're humans. And so we can't just isolate their identities into something that makes us feel comfortable and perpetuate that in the way we talk about things in our classes. We want our spaces to be safe and validating for all our students. And that includes being vigilant and aware of students who may not be safe for queer students, right? Students show up and know you learn very quickly. I'm sure this is an experience most of you have had, but you know very quickly when someone is not a safe person for a queer person. Certainly if you're a queer person, you do. But we need to be better at making sure that we can make our space safe and make it clear that bigotry isn't going to be tolerated, right? And make it clear and do like Trent was talking about sort of at lunch, is like do some of the hard things to make it uncomfortable to be hateful or to say, I just don't have experience. It just doesn't make me comfortable, right? Because that's in opposition of what our stated ethics are. And so we need to be comfortable as educators to say, that's not okay. Queer spaces, we need to, I think I talked about this already, but create space for struggles with one's identity, make it okay. You don't have to be one thing. You can change, you can evolve, right? Like we are beings that grow and evolve all the time. And so we need to make sure that we have space for students who may be struggling with that and understand how that might show up in different ways that may look to us like that student being unprofessional, or that student being dramatic, or that student being, you know, whatever adjective you most often use to describe students who are kind of a thorn in your side, right? It happens a lot, and we immediately lose empathy when a student is a little bit of a squeaky wheel. And when somebody's going through a major, you know, identity change, or their eyes have been opened up to something, or they've experienced maybe hate, right, like from their family, you know, we need to make sure that there's space for that in our classrooms and create loving spaces that are validating. Cultural competence includes LGBTQIA identities. I feel like I shouldn't have to have that on a slide, but I also feel like it needed to be on the slide. Because again, like I do a lot of this work, a lot of you have heard me speak and things like that. And I have probably, I know I have definitely done this on my own because I make my own assumptions, and we lean into people are getting more comfortable talking about race. They're getting more comfortable talking, you know, they're comfortable generally talking about like international students. There's a space that people are comfortable talking about relating to cultural diversity, and gay stuff's not it. So when we are talking about cultural competence, it has to always include the LGBTQIA community, because if not, then we are making space for students to graduate who will tell somebody to pray the gay away, who will be happy that conversion therapy is still legal in certain states, right? We need to be able to assess for that in the same way we wouldn't graduate someone who, you know, demonstrated blatant racism. Identify our own shortcomings, biases, and assumptions. Again, this is one where people will be like, oh, I have a gay friend, or, oh, I watched the L Word, or Will and Grace, or something like that. And so like, I'm totally down with the gays, right? Like I love the gays. I feel like you see that a lot, and people, you know, think feeling comfortable about the fact that people are gay is the same as not having biases about it, or not having that internalized heteronormativity like in their soul. And so we as educators, it always has to start with us, and we need to be able to model that for our students. And if you struggle with something, if you mess up with something, it's okay to share that with your students. And we should be doing that, because that's how we create those spaces that are actually learning environments. We need to be able to challenge students to recognize their own. And again, if we can't do it, how do we expect them to do it? Right? I love this sort of notion that like the professors don't have to go to the certain continuing ed sessions because they've been a professor for like, you know, dozens of years. And so they don't have any, you know, anywhere to go. Right. And it's the same when we're in practice, when we see supervisors who, you know, opt into something that is their comfort area, instead of making them have to think about the fact that they are probably hurting somebody. Right. And sometimes it's unfortunate that we have to be that harsh about it because we want to be kind. But I recently had someone say to me, being kind is not the same as being nice. And we can do things kindly that are hard. And we can communicate hard things kindly. And it's important for us to consider that, because when we're protecting someone's ego over here, who are we harming over here? Right. And how are we perpetuating our programs, graduating students who are all the same, and maintaining this, you know, very homogeneous population of counselors that exists in our field. And then finally, respecting pronouns and preferred names. So I know this is, I'm surprised I'm still able to even be standing up here and saying these words, but there are ways to do this at institutions where you're not allowed to do it institutionally. It is very doable. It is not even that hard, actually, to just be respectful, right? My dad's name is Michael. He likes to be called Mike. People call him Mike. He corrects them sometimes, and it's okay. Right. And so it can be as simple as that. And then, you know, we can model for our peers, right? If somebody is misgendering or, you know, using a dead name in a faculty meeting, we need to take up space to correct them. That doesn't mean it has to go through an institutional, you know, Canvas site. We don't have to submit paperwork. We can just show up in that space and use our voices in that space, right? And maybe somebody doesn't like that. And maybe most of you in this room have tenure and I don't, but I would still do it and I don't have tenure. But there are definitely ways to do it in ways that students also can feel like they can opt in and out, right? Like I have little whiteboard name tags because we have too many students for me to keep track of their names. And I just say, I put mine up and I put my example and I say, here's pronouns, please put your preferred name. And students opt in or opt out on their own volition, right? It's not excluding anybody. It's not making a big deal of it. It is just embedded in how I do it. I will occasionally have a student email me before the class starts because we don't have the mechanism in our system anymore for them to do it that way. But that's as simple as it could be, is just you model it and then allow there to be space for somebody to opt out and then allow somebody actually to feel included. That's really the ultimate takeaway. So this is a moment of reflection. Are you a safe person, right? I assume you're here because you want to be, or because you just had nowhere else to go, also possible. But I think we all, if we are in this field, we want to believe that we are a safe person. And I think inherently most of us have the capacity to be a safe person, but we can get complacent with ourselves, right? We can decide that something's hard or we're too taxed from our own personal lives and our own stuff, right? Which is perfectly legitimate. But it's very helpful to really consider some of these things as we work with students and consider what might be going on for them and how we can show up in ways that is more supportive for them and what they may be going through. And so, number one, I got called out on this actually, so I'll even use a personal example. Do you assume all of your students are heterosexual? Or do you just think to yourself, I don't want to think about their sex lives. I don't want to think about who they're dating. I don't care about that, right? And you may not. That's possible. But somewhere underneath that, it's because you do just assume that they're probably straight. Somewhere deep underneath there, right? Because we've been told not to look at that, not to think about it, not to worry about it. Many of us don't know what's going on in the dating lives of our students. But if we move from a place of heteronormativity, then we are probably somewhere underneath that invalidating them in some way, or not making the opportunity for them to be themselves with us, implicitly or explicitly. Do you think the pronoun, quote, debate is overblown? Do you, in your personal life, right? Like, do you go through the world thinking, I don't get what the big deal is, or saying that, right? And you may be like, I don't get what the big deal is, and I agree that we should be using pronouns and respecting pronouns, right? But that is still invalidating to say that, why is it such a big deal? When we know that there's a direct relationship between correct gendering of somebody and decreased suicidality. It is a big deal. It should be overblown. That's a simple thing to change to make it so that somebody doesn't want to die, right? That somebody can see hope. That is actually a big deal. Do you tell students that they can check it at the door? This is my number one biggest soapbox in my class, and I could talk about it all day, because we enter the room with everything that we are, right? In qualitative research, we have to write huge paragraphs about it. We have to talk about it. We have to reflect on it. We have to think about how it might show up and how we interpret our data. And yet in the classroom, we often tell students they can just check it at the door, and that's, quote, bracketing, right? That's actually not how it works, because if you don't know what's in there, if you don't know how it's going to come out, if you don't know yourself well enough, or look at yourself with a critical lens, then you can't check it at the door, because it's going to come up like verbal vomit somewhere. You're going to repeat some sort of phrase that you heard somewhere that you just assumed was okay because you think you're a good person, right? And I see this a lot with students when I give, some of the more challenging case studies that I'll give for us to talk about in class. And it'll come up in ways that they'll be like, oh, I didn't realize I thought that until I was confronted with this, right? And so if we just allow them the safety of, you can just check it at the door, and this, I would argue, applies to like all of our counseling and not just queer counseling and queer students. But if we just are perpetuating that notion, that misbelief that you can check it at the door, we are allowing them a level of safety that queer and marginalized students do not have, because they cannot check it at the door. Sure, maybe they can pass in whatever way that passing is safe in a given setting, but they are still who they are, and they bring all of that into the room with them. And they may have to be confronted with somebody who, a client who is, who believes that they shouldn't have the right to exist, who believes they shouldn't have the right to marry who they want to marry, who believes that pronouns don't matter, right? That trans people aren't real. And our student can't, that queer student can't check it at the door. Because we can't. You are all sitting here with whatever identities you have, with whatever you were brought up with whatever you did today, whoever you spoke to today, whatever choices you've made along the way. And that's okay. That doesn't mean you're not going to be able to manage what you have, right? But you can't just leave it there. You absolutely cannot. And then, are you out in your allyship? In what ways do you actively show up as an ally? Are you outing yourself as an ally, right? So do you have, signs up in your office? Do you talk about queer things in your teaching? Do you make intentional efforts to be inclusive in the way that you talk to your students and about clients and counseling in general, right? We often talk about the difference between not being, well, maybe not often. I talk about this stuff often. Maybe many people have different conversations than I do, but we talk about the difference between being anti-racist and just being not racist, right? And we understand that the difference is being actively anti-racist is the action, right? We are actually doing it. We're showing up in ways, we are denouncing racism, we are recognizing, anti-Black capitalism and all the things. And when we just say, I'm just not racist, that's the passive version of, but I'm a good person, right? And the same thing applies to being out as an ally for queer students. Are you just, I'm not homophobic. You just put that over here, you never bring it up again, and you only say it if somebody directly asks you. Or are you out as an ally? Are you out to say, I'm here for our queer students. I want you to know, I see you, I hear you, I'm safe for you. I'll show up at your Pride event. I'll put a flag, I'll get safe zone training, whatever you need to do to communicate that to your students. Because otherwise, students are not gonna feel safe to come out, particularly, depending on the state that you're in, it's going to be a significant difference. And again, this is something we teach our students about when it comes to their clients and providers, right? When we talk about marginalized clients and how a provider before you may have treated them poorly, so they may be reacting to that in you. We need to also understand that our students are reacting to us based on how they've been treated by our institutions and by people who look just like us, right? And how has your life been unaffected? Does the news not affect your life? Are you able to move through the day without having to check the news, without having to worry that you're going to lose a right, without having to worry that you hold hands with somebody and you're not going to be subject to a hate crime, right? Those types of things, these types of questions are hard and uncomfortable, but they really matter, and they are intended to sort of open that door in your brain to say, you know what, you're right. Sometimes the news is really hard and uncomfortable, and I don't read it as a result. I have opted out, right? And your ability to opt out of reading the news is directly correlated with your level of privilege. And so the more likely you are able to just opt yourself out to make yourself comfortable, the more likely it is that you are ignoring the plight of a group of people who need you to show up for them. Okay. And that doesn't mean you have to be in it all day, every day, right? There's ways to take care of ourselves and consume what's going on, but also know that those of us who have marginalized identities, we're reading it all the time and trying to make sure we're taking up space for our students, which is additional cultural taxation. So the moment that you opt out, we have to step up. And that's not fair and it happens, I would even say, primarily to Black women in academia, but it happens across marginalized identities when you feel passionately to be there for your people and you know that you have power and privilege in a given space. So what to say and do, here's a little guide, if someone comes out to you or in class. This is based on my actual experience of talking to other professors. So number one, don't make it weird. Don't make it about you. Don't have some over the top reaction. Also, don't say, this really happened. Oh my God, I couldn't tell. Okay. Things that might make somebody feel like it's not okay that they just did that, right? Because we have to recognize if someone comes out to you, they have made a multi-layered choice to do so. They have considered the pros and cons. They have weighed what you have showed them and decided to take what can feel like a very big risk, particularly if you're a professor and you're in a position of power, right? And even more so if it's in a class setting and they do it in front of their peers as well. So we express gratitude. Thank you for sharing that with me. You don't have to say anything else. I do this. I teach our multicultural class. I think I mentioned we do social identity wheels. Every single time on a social identity wheel that somebody in their boxes identifies a sexual orientation or gender identity, I say thank you for sharing this with me in my little icon in my little canvas remarks. Thank you for sharing this with me. Thank you for sharing this with me. Thank you for sharing this with me, because I want them to know that I don't take that for granted. And that is a very small thing we can do to show up for students who may feel like, I thought about that for an hour before I decided to put it in there, right? Or I might be worried that somebody's going to see that, and I chose to put it in there anyway. We want to listen and make space for their emotions, right? Again, as I talked about before, students may be grappling with this information. You may be one of the first people that they've talked to about it, because it might not be information they're comfortable sharing with their families yet. And so making yourself available to have a conversation if they need it, not just saying like, oh, I didn't know. Thank you for telling me. And then like running away, right? Follow up, send an email, just be there, right? In the same way we would be there for a student with any other kind of issue. Not to say that coming out is an issue, but any other kind of thing that comes up during their time in a program, right? That we would want to be more present for. Be available. Like I said, follow up with an email. If it comes up in class and it seems like it's, their face is red, they seem a little uncomfortable, they're a little bit fumbly, do we want to make sure we follow up over email? Again, in the same way we would if a triggering topic came up in class and we noticed that a student was having a hard time. Acknowledge your own feelings and reactions. Again, thinking about, what does this mean that I'm feeling this way about it? What does it mean that I feel uncomfortable? What does it mean that I don't feel like they should be talking about their sexual orientation in class? What does it mean that I don't feel like I want to know about their gender identity? I'll tell you what it means. That's that heteronormativity that I was talking about earlier. That's, exactly what it means, is that we have been conditioned to believe to talk about LGBTQ plus identities is gross or inappropriate or not okay, right? But people are talking about their heterosexual relationships all the time, right? My favorite example of this is the first time I heard somebody, well, it was my sister, don't tell her I told you, but she was talking about like trying to have a baby in front of my mom. And I was like, I feel like it's really weird that you're talking to mom about like having sex. And it's like so normalized that this is a conversation that you would have, but in another community, it might be not okay to just mention that you're dating someone of the same gender, right? And then maintain privacy. So maintaining students' privacy is paramount, because that student has come out to you. That does not mean they have come out to the rest of the faculty, and it does not mean that it's the rest of the faculty's business. And so I see this come up. When I used to work in community practice, I would see clients get outed all the time. And again, in the same way we protect the confidentiality and privacy of our clients, we should be maintaining privacy of our students, and really only bringing something up if it's pertinent to a given situation, which it probably in many situations is not, right? Unless somebody needs context or you need to protect that student from another student for whatever reason. So moving towards an inclusive profession. LGBTQ plus populations seek and utilize counseling services more than non-queer folks. So again, that representation piece is so important for us to think about. How are we opening our doors and making our programs more inclusive so that more queer counselors are coming and filling our markets and meeting the needs? LGBTQ plus and trans people have been found to be significantly more likely to report having a disability. I mentioned this already. So we're seeing proportionally a lot of intersectionality that, again, we should be attending to instead of, just trying to say, oh, here's how we counsel disabled people, here's how we counsel queer people, and never the two shall meet. Improve competence for LGBTQ plus rehab counselors, right? Frank has been doing this research for a long time, and we still really don't have great competence in our field pertaining to LGBTQ plus populations. And in part because we have recently found that rehabilitation counselors don't even think that their professional organizations should be concerned with diversity and equity. So we have that going on in our field, right? We have the problem that when we hire people and we have people in the field that are not trained at the master's level, or who get, beat down with the bureaucracy of vocational rehabilitation settings, that they don't think that this is a part of somebody's needs in vocational rehabilitation. And so then we know that we're missing the mark in terms of competence and inclusivity. Recognize ethical dilemmas with regard to discrimination. So we experience discrimination in the classrooms. We may hear a student be discriminatory in the way they're doing counseling with somebody or preparing to do counseling with somebody. And we need to make the choice to act as an ethical educator to put the competence of our students in the forefront. And that means that we know that they have to be competent to be an ethical practitioner, to be competent with working with LGBTQ plus students. I had a student recently this semester who pushed back when I said, I gave my worth and dignity speech. And I said, that means everybody. No ifs, ands, or buts, right? And they were like, oh, well, but can I refer if I don't feel competent? And that's always the sticky widget, right? That's always the thing that somebody comes back to. Well, if I don't believe this person exists or has a right to exist, I am then therefore not competent to work with them. Yes, and also you're not competent to be a counselor, full stop. Right? There's no wiggle room for that. It's not okay. So for me, that I don't even consider that to be an ethical dilemma. I just think that that's the way it should be, but many people experience that as an ethical dilemma. Incorporate and integrate the SAGE competencies for LGBTQ and transgender counseling professionals into training programs. In the same way, we have a session going on right now for CRC and KCRAP talking about infusing disability into the counseling curricula. We should be able to be infusing the SAGE competencies into our counseling curricula, right? And again, not just, oh, I taught about this one special population, this 1 minute, this 1 week during my class. And so I just grabbed a sample of the competencies to bring to your attention here. They are linked and you can easily find them on the SAGE website. But affirming that LGBTQ persons have the potential to integrate their affectional orientations and gender identity into fully functioning and emotionally healthy lives and relationships, right? That's just affirming. That's like the baseline. That's like the bottom of the pyramid, right? Like just affirming, just yes, you can do that. How simple is it for us to do that and to allow that to take up space? Identify the heterosexism, biphobia, transphobia, homophobia, and homoprejudice inherent in current lifespan development theories and account for this bias in assessment procedures and counseling practices. This is something we are grossly underprepared to do in our field, right? Our counseling development theories have not evolved to be inclusive of queer identities, particularly not trans identities, and similar with lifespan development. We know it's not a linear process, and we keep teaching the theories that say that it is. Recognize that the coming out process may impact an individual's return to earlier stages of development that may or may not be congruent with their chronological age. Again, we should be great at this because sounds like it's straight out of a psychosocial adjustment theory, right? It's the same concept. This big life change has happened that fundamentally changes how you see yourself, how you move through the world, how you have relationships, all these things. And we make space for that to mean that you may have to go backwards in order to move forwards. It's the same thing. We, in this field in particular, should be leading that charge. Acknowledge that heterosexism and sexism are worldviews, as well as value systems that may undermine the healthy functioning of the affectional orientations, gender identities, and behavior of LGBTQ persons. And so we need to understand that our queer students are hypervigilant about the people that are in the room with them. And that means that changes how they show up in our spaces. That means that you may have a student who's pretty quiet in class and maybe gets labeled as lazy, but it's because they don't feel safe with the person sitting next to them who has, some sort of intense sticker on their computer. Again, that's an example pulled like right out of my classroom. Or they may not be comfortable when you have, somebody over here who is asserting aggressively, that they want to infuse religion into everything that they do and that they don't believe, in the right to equal marriage, right? Then it makes sense that somebody might be quiet and not just stand up and advocate for themselves right in that moment. But we as educators need to be brave and take up space in order to show our students that we will do that and that we will protect them. And then the final of the sample that I have up here, understand how the intersection of oppressions such as racism, homophobia, biphobia, classism, or sexism may affect the lives of LGBTQ individuals. For example, queer people of color may be marginalized within their LGBTQIA communities, which means they may lack a type of support that could operate as a protective factor, homelessness rates, and access to healthcare services. There are increased rates of homelessness among people who are in the queer community, right? I gave an example earlier of a student who is from a different country, right? And his family cut him off because he came out. And so he was at risk to be unhoused. And so that is not, unfortunately, it is 2025, right? That is still not an uncommon experience. And then what does that mean for our students who are maybe already coming from a lower socioeconomic background, or they're coming from, a broader community that is not inclusive and they don't have a place to go back to. And all of the psychological and emotional layers that somebody has to go through to get to a place where they feel comfortable being their authentic self, even having to acknowledge that they may have to give up, some of those foundational relationships that they have, or what does that mean for them in relationship to their cultural identities as well. And this is just a small sample. The SAGE competencies are extensive. And so it's multiple pages. I thought these were the ones that would be salient to this presentation, but again, I highly recommend circling back and looking into them. And just finally, without community, there is no liberation, right? So we are a community. We are in the counseling specialties. We are a solid, small group, but we have excellent community. And it's a high tide rises all boats, right? And so I think when we start to be more inclusive in the way that we think and the way that we move in our classrooms, we will be able to put out counselors who can meet the needs of the market. They can be more inclusive. This is like a situation where we can actively affect like suicide rates and suicidality, right? You have like directly in this moment the opportunity to make a change in someone's life and make it so that something you've done or not done doesn't contribute to increased suicidality for that one person. And I think that is something that gets lost. And, not to be alarmist or extremist, but it is literally a life and death situation, right? Because we have control over small spaces like our classrooms, like our personal interactions with students, the ways that we show up in different spaces, but we don't have control over our institutions. We don't have control over our state legislatures, and we don't have control over these broader systems that are actively harming our students. And we need to be the difference. And love is love. I'm done, guys. Anybody have any questions?
Allison, I think there's one that it's a great question. Someone from the audience is wondering if there's any programs available if someone's interested in adding a certificate or some sort of an endorsement in counseling with the LGBTQ plus population specifically. Do you know of anything that they can do as counselors?
I don't know of anything in terms of counseling specific. The one thing that comes to mind for me is the safe zone training. That is usually available through like institutions, or I think even sometimes public health organizations have access to that. And so that's like a training and like a placard you get so that like my door has like a big gay flag on it to, that says safe zone. So, if nothing else, a student knows that they can go there. But in terms of the counseling field, I don't think that there's anything that I know of. I'm open to anybody saying if they know different, but any other? Time, sorry. Okay. Thank you everyone for sticking it out this afternoon.